We don't offer a Pico laser here at You by Dr. Shauna Watts. We did lots and lots of research and lots of investigating before we chose the lasers that we would have here at the clinic. And I feel very satisfied that the lasers we've chosen, satisfy everything we would be able to achieve with the Pico and much more. So our main laser is the V+ laser by Qterra. I have to admit, I do use a little bit of both of the ranges, or a lot of both of the ranges that we have. So we've got Skin Better Science and Retinol, and I do also use some Vita Glow products and Crumble Beauty Bites as well. So there's a lot of stuff going in there, but maybe I could make a video and show people what I'm doing. Would that be helpful? Although freckles and melasma are both types of pigmentation, they really do need to be dealt with differently. So maybe I'll answer those questions separately if that's okay. So with melasma, I strongly believe that this definitely should be a condition that has treatment under the supervision of a doctor, as it's very easy to make melasma worse. But we definitely approach it in various ways. Obviously, very, very important is checking whether the person's on hormonal treatments like the contraceptive pill or HRT, and making sure that they're wearing sunblock and a hat when they're outside, working with skincare to have some kind of pigment blockade, and then working in the clinic using specific types of peel like Cosmelan to really work on that very difficult pigment to deal with. And there's also some laser treatments that you can use, but again, they have to be used with caution because you could potentially make it worse. And then freckles, well, I suppose they're probably less upsetting to most people than melasma would be, but again, we would have to come at that from multiple levels, making sure that people know that, we can definitely get rid of your freckles or reduce them a lot, but if you just go straight back in the sun again, they're just going to recur. So that again, that's going to be a combination of using, a laser for pigmentation, peels for pigmentation, and also obviously sunblock all the time, a hat, and some at-home skincare as well. No, we don't have gas, but we definitely look after lots of patients who are quite scared of needles, and we've got some really great injecting techniques. We're very gentle. We can use numbing cream if it's necessary, and we also have some distraction tools as well. So I have to say, there's no one who's never gone through with it, and we seem to have managed fine without gas. Okay, good question. So definitely people with sensitive skin can use a retinol, but I think it's really important to introduce it quite slowly. So I'd probably start off using it maybe twice a week for a few weeks, and then increase up to every second night, and gradually aiming to get to nightly. I think it would be important if you've got sensitive skin to come and have a conversation with us, because there may be some other things that we need to do to get your skin resilience improved. So the toxin that we use here in the clinic, toxin B, lasts on average 12 to 14 weeks. There is some data to suggest that if you're maybe like an ultra marathon runner or you exercise a lot, you may not have the full effects for the same amount of time. But for the average person who's exercising, walking or going to the gym most days, it shouldn't make much of a difference, to be honest.